It is my pleasure now to introduce Dr. Margot Sunderland, who is the Director of Education and Training at the Centre for Mental Health in London. She's also the co-director of Trauma Informed Schools UK, the honorary visiting fellow at London Metropolitan University, a child psychotherapist with over 30 years of experience of working with adults, children, teenagers. Margot is the author of over 20 books in the field of child mental health, which have been translated into 18 languages and published in over 24 countries. She is passionate about social change for a kinder, warmer world. Conference, I give you Margot. Thank you.
Thank you so much, Kima. Okay, I'm just going to share screen a minute. Here go. Okay, share
doing the tech stuff. Thank you, Margot. Just a reminder for the chat room that we'll kind of quieten the chat room as your slides are coming up. And is it all right if I give you a 5-minute time check, Margot?
Yeah, absolutely fine. Yeah, are you? Can you see that okay, John?
That's come up really clear. Looks lovely, Margot. Thank you.
Good.
Great.
Okay, so just to say that you will get the full text of what I'm saying, and there are a few key slides that John's going to put in chat, hopefully. And we have permission to show some clips because we are Trauma Informed Schools, which I'm one of the directors, is a member of Education Recording Agency. So schools are being fed two deeply concerning messages about how best to support pupils and students who are in psychological pain. The two main models are the psychiatric disorder and chemical control of children model, and the second one is learn to manage your feelings. And as I'm going to present, both of these are failing children and young people dismally. So lots of courses for mental health leads. I'm not going to mention them in case I don't want to be sued, but basically they are learn to spot the symptom, the disorder, the illness, and refer on. Well, refer on, that's crazy when we have in some areas 2 to 3 years waiting list for CAMHS. But so let's look at that first model. So many teachers know, right, okay, spot the symptom and spot the disorder like ADHD and refer on. Well, when a child or teenager is given a diagnosis, people stop thinking. And look at the chemical control of children. So last year there were 75,000 prescriptions for Ritalin. And we see in this country 83.4 million antidepressant drug items were prescribed. The math doesn't add up because of repeat prescriptions. There are only 68 million people in the country. And yet, and Joanne Moncrief will be speaking about this, they've found that, you know, in the public arena, people really do think it's about chemical imbalance. In fact, 90% of people think depression has got nothing to do with psychological pain, but to do with serotonin. And yet Moncrief's wonderful research shows that there is no difference in the serotonin levels in people diagnosed with depression and healthy controls, and no difference in the serotonin transporter genes between people with depression and healthy controls. So the abuse of giving someone, particularly children and young people, a psychiatric diagnosis and medication without ever hearing their story. So I'm going to play now, Rachel, I'm just going to go back a minute, yeah. Rachel is in care, an inpatient. It costs 230,000 a year to be an inpatient in CAMHS, and she's been diagnosed with emotionally unstable personality disorder, and no one has ever heard her story. But when you hear Rachel, you'll see, you know, she's desperate. She just wants someone to hear her story, and no one has ever done that.
How many times you tried to kill yourself?
In my life or in the past year?
Both.
In the past year, easily 50, 60 times, probably. In my life,